Welcome to Balancing the Scales, the Economic Justice Report. This is your host, Vic Bernsdorf, and on today's show, we're going to be discussing the plight of home health care workers and Quebec's low-cost childcare system. Before I get to those stories, got a comment from viewer Mandy in Stockton asked me, Vic, what do you think are the best states for quality of life for its residents here in America? It's a really good question, Mandy. Let me just tell you that there's an institute called the Legatum Institute, and answer that question directly. So watch a clip and come back and talk about it.
No single state has yet succeeded in fostering a high degree of both economic and social well-being for its population. Other than top-ranked Massachusetts, no state ranks above 20th in all 11 pillars of prosperity.
Okay, so let's discuss that clip a little bit about the United States Prosperity Index. What that clip showed from the Legatum Institute again, it showed 11 quality of life indicators across all 50 states. And as you can see from the chart, also from the video, it goes from green to dark red across, again, let me name these indicators again. Quality of life indicators, 11 of them, okay? Business environment, market access and infrastructure, economic quality, safety and security, personal freedom, governance, social capital, living conditions, education, health, and natural environment. So if we just take health, just to talk about the health, a quality of life indicator across all these states, let's have a look at what it says. Starting at number 25, which is Pennsylvania, which is marginally blue, I guess, state. Below number 25, there's only one light blue quality of life indicator for health, which is in Ohio. All other states below Ohio, okay, which is number 34. So from 35 to 50, they fail. Okay, they fail. They're not green anymore, in other words, okay? Either yellow, orange, or red, which means access to health, cost of health, quality of health in those states are really, really bad. And what are those states? Those are red states. Those are Republican legislature, run by the Republican legislature states. Okay? And the highest quality of life, as you can see, are the ones in the green, mostly green. And guess what? They have Democratic legislatures. Okay? So if you want to work and live in one of the top 10 states, which are Massachusetts, Connecticut, Minnesota, New Hampshire, Washington, Vermont, Utah, Colorado, Maryland, New Jersey, District of Columbia. Those are all democratically run states except for Utah. Okay? That's really interesting. Okay? So, again, go to this chart, refer to this chart every year. They update it, and you can find out what the quality of life is across 11 indicators of quality. I just talked about health. There's 10 more you can look out for yourself. You can check out yourself. Okay, now let's move on to the plight of home health care workers in America. As usual, let's watch a clip about that, and we'll come back and discuss their tragic situation.
Julie Reduta knows firsthand the true costs of the long hours required for elder care.
We get up like 5 o'clock to prepare their breakfast. 7 o'clock we start helping them bathing and hygiene.
She was a live-in caregiver who expected to work around 12 hours a day, but says in reality the hours were much longer.
My experience is like 24 hours, 7 days a week, $800 a month.
That comes out to about $2 an hour. Reduta, who now has a job with a different employer, says her former boss refused to pay her more than that monthly sum, even when she worked extra hours.
She explained that we have to be grateful of that 800 because she's giving free food and free accommodation, but we're sleeping in the living room with no blanket, nothing. When you abuse animals, you can end up being in a jail, and we're human beings, so I feel like worse than animals.
Pretty distressing, pretty tragic story about home health care workers. what's the overview of this industry and of these home health care workers? Well, let's just say that 80% of home health care workers in America, they're dominated primarily by for-profit agencies. Okay? Now, the coronavirus pandemic has shown just how essential home health care workers are who care for our aged loved ones. Okay? Many of these care workers struggle with no benefits, and many are in poverty situations, as you've just heard. Right? Taking an in-depth look now at some situations. The median hourly wage for home health care workers was $11.03 in 2017. That's compared to $10.66 in 2007. So in 10 years, it went up like 50 cents. Okay? Also, a lot of agencies don't provide company vehicles if driving is needed to go to doctor's appointments. So home health care workers have to pay for those expenses by themselves as well. Okay? That's not, it gets worse. Okay? Home health care workers have lower job stability, shorter working hours, and are less likely to have benefits. Okay? And that all results in about 20% of home health care workers living in poverty. Okay? Personal story now. Name is Jasmine Almodovar, 35 years old. She says she earns $9.50 an hour. I quote, "We work really long hours, we work really hard. A lot of us are barely come home because if we don't go to work, we don't get time off. We don't get paid vacations, and some of us haven't had raises in years." She continues on, "I don't have a retirement plan, I don't have life insurance, I don't have medical," she says, "because by a government basis, I'm 90% above the poverty level, but I'm in poverty." Okay? So what's the takeaway from this segment? The takeaway is that the personal suffering of home health care workers is really, really horrendous. Okay? Folks, we got to start unionizing these workers to help stop this economic abuse. Okay, this next story is all about Quebec's universal childcare system, providing low-cost childcare for everyone in that province in Canada.
The Canadian Centre for Policy Alternatives study found that childcare costs have risen faster than the rate of inflation in more than 60% of Canadian cities since 2017. Childcare for infants was the most expensive. The three cities at the top of the category were Toronto at an average of $1,685 per month, Mississauga and Hamilton, and Kitchener at $1,490 a month, and Vancouver at $1,400 a month. By comparison, Quebec cities were amongst the lowest, clocking in at an average of $175 a month, followed by Winnipeg at $651 and Charlottetown at $738.
So let's start by giving you an overview of what's going on with that and how it puts childcare in America here into shame. So, Quebec's program introduced low-fee universal childcare in the Canadian province in 1997. This is a full-day, year-round childcare program for all children under 5 years old, which the Quebec province subsidizes. Families there pay on sliding scale, with the wealthiest families paying about $17 per day for their first child. Basically, if everyone pays a little, then no one pays a lot, and that's the whole goal of the program. Take an in-depth look now. Since the beginning of the program, Quebec's women in the workforce reached 85%, which is the highest in the world. Okay? In Montreal, a day of childcare costs an average of $10. That was in 2016. Cities and other provinces cost over $47 a day. These are a little bit old. These numbers are a little bit old. The Quebec government provides Canadian families up to 55 weeks of paid leave for parents when they have or adopt a child, as well as a yearly allowance of about $500 to $1,900 the family receive for children under 18 years of age. Okay? Now, according to Childcare Aware, they found that America's average parental costs are $9,000 a year for one child daycare in 2017. No matter how you look at the statistics, childcare is totally unaffordable for most families in America. Absolutely. Okay? Personal stories. This comes from your viewer comments. I quote, "We moved from New York to Montreal. In New York, we were paying $1,600 a month for daycare. Then we moved to Montreal, and we were paying $150 per month per child. $1,600 to $150. Okay? Pierre Fortin, Canadian's leading expert in the economics of subsidized childcare, says the private sector doesn't have the same quality standards as the government because mostly parents care about the price, right? And one way they reduce the price, the private sector, is to reduce the quality, right? So what's the takeaway from this segment? Canadians pay higher taxes than Americans, but because of government benefits like subsidized childcare, they have a higher quality of life and are able to accumulate more savings than Americans as a result. Okay? And we got to get on board, not just with Canada, but with the Nordic countries and Northern European countries. I mean, it is 2020 already. Okay, why does the government of this country keep allowing as many people to suffer? Okay, folks. Before the show ends today, I just want to give you an example. Basically, this is an addendum to the critical thinking story I made last week. I want to show to you now how you can use critical thinking when you buy products. Okay. First, I'm going to read to you this segment real quick, and I'm going to show you an example of critical thinking at home. So, this comes to you from dearly.com, and this is a quote from an article. It says, according to an article from the New York Times, in 2006, it was reported that Fabuloso, which is a common cleaner, was responsible for more than 100 accidental ingestions because of its semblance to a soft drink and pleasantly fruity smell. End of quote. I'm only mentioning that because if you design a product that looks like a juice drink, right, with colors and labels that attract kids, if it can be done, it will be done. And in fact, some kids thought Fabuloso was a juice and drank it. I don't know what happened. You can go to the New York Times report, check it out yourself. But keep that in mind whenever you buy something. I recently bought this. I'm not going to show you the name of the manufacturer. I'm just going to show you what this is. The name of the manufacturer is behind the bottle here. This is a hand sanitizer, folks. A hand sanitizer, okay? It's in a wine bottle, okay? Hand sanitizer in a wine bottle, okay? Do you think that's a good idea to purchase a product that you may be using in a kitchen area? Especially since it's not thick at all. Look at that. It's not thick like it comes like a little bit of gel. It's not a gel, right? We're having a problem right now getting disinfecting wipes. So, my wife and I are using just paper towels and alcohol. And so I bought this bottle of hand sanitizer. I didn't think about the fact that it looks like a wine bottle. But if you think about it, right? This is used in the kitchen, right? You could be having a party, right? And if you put the label out of sight like I did here, and you're not there, I ran out of wine, and oh, this looks good, I'm going to try some of this, right? You know what, folks? You can be sued, and this manufacturer can be sued, okay? So this is a good example, I think, of critical thinking at the purchase level, okay? When you buy something, wow, you know what? This looks like someone may mistake it for a wine bottle. If the label is hidden and someone could take a drink out of it, and I'm going to be in big trouble. Okay, that is a good example of critical thinking, and that's why I wanted to just make an addendum regarding the last show on critical thinking. Okay, so on next week's show, I'm going to be talking about these two topics. Merchants of Doubt, which is a documentary that discusses how sowing doubt in your mind clouds your evaluation of making decisions. You don't know what's right or wrong. And also I'm going to be discussing how multi-generational living is making a comeback in America. My sources for my two segments I discussed today came from Bloomberg.com, GetPocket.com, NPR.org, and Workers.org. So, that's the show for today, folks. Thanks for listening. And always remember, you deserve the government you vote for. Have a great day.